Welcome. Today's topic is the rise of caregiver robots, exploring the impact of automated caregiving. Imagine a world where caregiver robots assist human caregivers in providing personalized care for older adults, disabled individuals, and even children. The future is not far off. In fact, it's here, and it promises to revolutionize the way we approach caregiving. In today's world, we're experiencing a human labor shortage. In our country, we presently have more older people than youth. Actually, it's a global problem. The decreased birth rates and advanced technology in healthcare and medical science has us living longer, but not always healthier. So, as we face a direct caregiver worker shortage, family members are faced with providing care to their loved ones. The family caregiver is providing quality and personalized care in the home, spending time with their loved ones as a companion, and taking care to make sure their loved ones take their medicine and help with daily activities. They provide social interaction that is so desperately needed. So many older people suffer from loneliness and social isolation. Many family caregivers do not realize that the expected caregiving journey on average is 6 to 8 years. Some family members are providing care for as long as 20 years. So let's explore the rise of caregiver robots, discuss their potential benefits and challenges, and examine strategies for effective robot assisted caregiving. Join us as we delve into the fascinating world of automated caregiving, where technology and human touch work together to create better care for all. Will the development of robots make caregiving easier or more challenging? Will researchers find robot malfunctions give human caregivers more work? Let's explore. Over the next year, I'm going to introduce you to the latest and greatest technology that science has to offer, and we will monitor and discuss what researchers are discovering about the development and acceptance by society of caregiver robots. Robot caregiving is rapidly changing the future of providing quality of care to the elderly, disabled, and even our loved ones with dementia. This technology is becoming increasingly popular due to a need for additional caregivers as we face staff shortages of nurses and direct care workers. The risks and potential challenges allowing robots to provide care to loved ones is the loss of empathy and the human connection and increased feelings of social isolation. To the point we must address when introducing robot caregivers into the elder care system, such as in nursing homes and assisted living, or even in the daily lives of older people in their homes. We want to maximize benefits and minimize risk over the use of human caregivers. Responsible integration requires striking a balance between technology and human touch through collaborative models while considering ethical guidelines and promoting cultural sensitivity. The emergence of caregiving robots. As the world's population ages, the need for caregiving services is growing rapidly. In response, robotics developers are creating innovative solutions to assist human caregivers in providing quality care for older adults, disabled individuals, and those with dementia. Caregiving robots are becoming increasingly popular around the world, with different types of robots being used for various caregiving tasks. From humanoid robots designed to mimic human interaction to robotic devices specifically tailored for the nursing home setting, the future of caregiving is rapidly evolving, powered by cutting edge technology and artificial intelligence. There's a global adoption of caregiving robots going on. While robot caregivers are still relatively uncommon in the US, they are gaining popularity in countries like Japan, where the government has allocated a significant portion of its budget to develop CareBot. And this has been going on for decades in Japan. The global personal robot market, including robot caregivers, is expected to grow rapidly in the coming years as more countries face the challenges of an aging population and a need for additional caregiving workers. As robot caregivers become more widespread, it is essential to consider the potential effects on human caregivers' employment, as well as the quality of care provided to older adults, disabled individuals, and their families. So, different types of caregiving robots. There are several types of caregiving robots available, and is growing by leaps and bounds each day. Each is designed to address specific needs and tasks. For example, the Dinsao elder care robot, CareRobot, Pepper and NAO robots, there's Bean Q and EllaQ, all offer unique features and capabilities to assist human caregivers. Robots like Pepper and NAO have advanced algorithms that can detect facial expressions, body language, and vocal tones. They can adjust their own faces and voices to replicate human interaction. They can also remind residents to exercise and eat, lead them in dance, and tell them jokes to keep their minds sharp. By providing both physical assistance and emotional support, these robots play a vital role in enhancing the lives of older adults and complementing the efforts of human caregivers. So let's talk about the role of robotics in healthcare. Robotics is not only transforming caregiver, but also playing a significant role in the broader healthcare industry. Robots can assist with surgical procedures, manage medications, monitor patients, clean and disinfect facilities, store and distribute medicines, and even help with administrative and logistical tasks. By automating these mundane tasks, robots free up healthcare professionals to focus on more complex and meaningful aspects of patient care, ultimately improving patient outcomes. Despite the promise of improved care and efficiency, robot caregiving also presents potential challenges that must be carefully considered. The loss of empathy and human connection, ethical considerations in robotic care, and effects on human caregivers' employment are also concerns that need to be addressed as we move toward the future where robots play a more prominent role in caregiving. The loss of empathy and human connection. One of the most significant concerns about robot caregiving is the potential loss of empathy and human connection. The Pew Research Center reports that more than half of the elderly express feelings of loneliness and social isolation. While robots can perform various tasks and mimic human interaction to some extent, they may not be able to provide the same level of emotional support and understanding that human caregivers can offer. This loss of empathy could negatively impact the care recipient's mental health and well-being, making it crucial to strike a balance between the efficiency of robots and the emotional support provided by human caregivers. We also have ethical communications to consider in robotic care. As robot caregiving becomes more prevalent, ethical considerations must be taken into account. Issues such as autonomy, privacy, dignity, bias, safety, transparency, algorithmic fairness, and data privacy are all crucial aspects that need to be addressed to assure the responsible and ethical use of robots in caregiving. By carefully considering these ethical concerns and developing guidelines and regulations, we can assure that robot caregiving is implemented in a manner that respects the rights and needs of care recipients. Now we got to talk about the effects of human caregiver employment. The growing use of robots in caregiving also raises concern about the potential impact on human caregiver employment. We're in a shortage right now, and they're saying that we're going to have a shortage of over 1 million caregivers by 2050. So the introduction of robots could lead to job displacement, job creation, or job transformation for human caregivers. While robots may alleviate some of the physical workload to address staff shortage in healthcare settings, their increased use could also create new challenges for human caregivers and change the nature of caregiving work. Here's one example I was reading the other day about a robot malfunctions that occurred in nursing homes in Japan. And the robot malfunctions caused more work for the human caregivers, and many times the robot ended up being placed in a closet, not being used. The Japanese government's budget has been addressing the growing aging population for decades. Japan has taken a very proactive approach to aging and the science of technology, as Japan's population, like the U.S., has a growing aging population and not enough youth to provide care. This is due to lower birth rates globally. So, as we continue to develop and implement caregiving robots, it is essential to consider the potential effects on human caregivers and the overall caregiving workforce. Assessing the demand for robot caregivers. The demand for robot caregiving is growing due to the increasing elderly population and the need for more caregiving workers. As more people turn to robots for assistance, it is vital to strike a balance between technology and human touch in caregiving. So let's explore the factors contributing to the growing demand for caregiver robots, including the growing elderly population, the state of the human caregiving workforce, and the importance of maintaining a balance between technology and human interaction in caregiving. The growing elderly population and caregiving needs. The world's elderly population is growing rapidly, with the number of people aged 65 and older estimated to double by 2050 and actually triple by 2100. This increase in elderly population places significant pressure on caregiving services as more people require assistance with daily activities and healthcare needs. The growing demand for robot caregivers can be attributed to this demographic shift and the need for additional caregiving workers to provide support and care for the aging population. We also have over 1 million newly diagnosed individuals with dementia each year. The growing number of dementia patients and their increasing needs is giving robot researchers a very different challenge. So I want to talk about the state of human caregiving workforce. The human caregiving workforce is facing limitations, with an estimated 53 million caregivers in the United States juggling caregiving responsibilities and employment. Most of these caregivers are female, and the number of available direct care workers is becoming so limited, it's resulting in a growing need for alternative situations, such as the robot caregivers. To meet the increasing demand for caregiving services, it is crucial to explore innovative solutions like robot caregiving that can supplement the efforts of human caregivers and alleviate some of the challenges they face in providing care. While technology can offer efficiency and convenience in caregiving, the importance of human touch and emotional support cannot be underestimated. It is essential to maintain a balance between technology and human touch in caregiving so that robots are used to supplement rather than replace human caregiving. By ensuring that both technology and human interaction play a role in caregiving, we can provide the best possible care to those in need while preserving the essential human connection that is at the heart of all caregiving. I want to take a moment here and share with you a story of what we did in the olden days of nursing. This was in the hospitals. Every night we did what they call HS cares. That's hour of sleep cares. We would get a cart with towels and washcloths and warmed lotion. And we would start at one end of the hall and work down the hall to see each individual patient. At that time, we would wash their face, their hands, wash their back, and we would assess their skin. We also would give a skincare, which was a massage. We would do their hands, their elbows, their feet, and their back and their bottom. We would rub them. We don't even do that in nursing homes anymore, and we lack so much human touch, and we're expected to do more for less. So I'd really like to see robots giving the caregivers time, the human caregivers time to actually interact. And it was a perfect time in those days where you would do the care, you would assess your patient, but you also educated your patient on whatever they needed to be educated on in their healthcare. Those are the things we need to get back to. So let's integrating robots into the caregiving ecosystem. As the demand for robot caregivers grow, it is crucial to integrate them into the caregiving ecosystem in a responsible and ethical manner. This can be achieved through collaborative care models, and that's just where robots and human caregivers work together to provide coordinated care to patients. So I want to discuss the various ways in which robots can be integrated into the caregiving ecosystem, the pros and cons of robot caregivers, and the importance of implementing robots with humility and patience. Collaborative care models are just a big word for team-based approaches to healthcare that involve multiple healthcare providers working together to provide coordinated care to patients. We already have this model in effect. These models have shown to be effective in managing mental disorders in primary care settings and can be applied to robot caregiving as well. By incorporating robots into collaborative care models, we ensure that they are used to complement the efforts of human caregivers and provide the best possible care for patients. If you follow my podcast, I encourage the development of a person-centered patient care profile. This helps the healthcare providers see your family member as a person instead of a diagnosis. I think it would be extraordinary for every elderly person to have a robot that is programmed with their person-centered profile. The robot would be able to provide information on the likes and dislikes of each individual. For example, I love rooibos chai tea with my breakfast. Wouldn't it be great that the robot will prepare my tea for me, then ask me about my life? Of course, my wish list in my mind is with the development of person-centered robots would be to share stories of our lives by asking questions and recording this information for others to hear at a later time. Or, as a person with dementia decline, they can listen to the stories they shared, maybe with pictures on the robot screen to stimulate memories. Of course, with my luck, my robot's going to make me exercise and monitor the intake of my sweets. So I guess there's downsides on this subject as well. So let's talk about the pros and cons of caregiver robots. While caregiver robots offers numerous benefits, such as providing physical assistance and task support, there are also some downsides to consider. The potential lack of empathy and the human connection, ethical issues, and the impact on human caregiver jobs all are concerns that need to be addressed as we move towards a future where robots play an important, prominent role in caregiving. By carefully weighing the pros and cons of robot caregivers, we can develop strategies and guidelines to ensure that their use is both beneficial and responsible. Implementing robots with humility and patience. When introducing robots into the caregiving ecosystem, it is essential to do so with humility and patience. This approach ensures that robots are integrated in a manner that respects the needs of caregiver recipients and the expertise of human caregivers, while also acknowledging the potential risks and challenges associated with caregiving robots. By implementing robots with humility and patience, we can create a caregiving ecosystem that benefits from the advantages of technology while preserving the essential human connection at the heart of caregiving. Strategies for effective robot-assisted caregiving. To make robot-assisted caregiving more effective, several strategies can be employed, such as providing physical assistance and task support. mental health and emotional support, and enhancing quality of life for care recipients. So let's dive into these strategies and explore how they can be used to ensure that robot caregiving is as effective and beneficial as possible for both the care recipients and their human caregivers. Providing physical assistance and task support to care recipients is an essential aspect of robot assisted caregiving. Robots can help with daily activities such as bathing, dressing, and meal preparation, thereby alleviating some of the burden on human caregivers and allowing them to focus on more complex aspects of care. Hey, as an RN, I'm trying to picture how this is done. I'm wondering if humanoid robot functions as a human care worker. I'm trying to imagine an army of humanoid robots providing intimate care, bathing, dressing, brushing a person's teeth, and making sure that they comb their hair. I can't imagine a robot taking care of somebody who's been incontinent. So I'm looking forward to learning how researchers and development of care bots meets this challenge. Researchers believe offering this support, robot caregivers can improve the overall quality of care provided to those in need, while also complementing the efforts of human caregivers. The jury's still out for me. We shall see. In addition to providing physical assistance and task support, it is important for robot caregivers to offer mental health and emotional support to caregiving recipients. This can include companionship, engaging in conversation, and providing emotional support, all of which can contribute to the caregiver recipient's mental health and well being. By addressing the emotional needs of care recipients, robot caregivers can play a crucial role in enhancing their overall quality of life and promoting positive mental health outcomes. One of the issues humans face is we develop emotional attachments to robots. This is a dilemma that is giving robots and their creators a huge challenge. Robots are unable to reciprocate feelings or develop attachments. The idea that robots become a companion seems far-fetched. But I can tell you, when I observed seniors in a nursing home interacting with a robotic pet, I too fell in love with these interactive creatures. In fact, I encourage any pet lover, especially those with dementia, to invest in one of these sweet creatures. Robot caregivers have the potential to significantly improve the quality of life for those receiving care. By providing physical assistance, mental health and emotional support, and empowering care recipients to take control of their own lives, robots can help promote overall well being and independence. As we continue to develop and implement robot caregiving, it is essential to focus on strategies that enhance the quality of life for care recipients, ensuring their needs are met and that they can maintain their dignity and sense of self worth. So, design principles and ethical guidelines for caregiving robots. As we move towards a future where robots play a larger role in caregiving, it is essential to establish design principles and ethical guidelines to ensure their responsible and effective use. So let's explore how caregiving robots can be designed to empower care recipients, balance assistance and independence, and address emotional dependency and ethical concerns. Empowering care recipients. An essential design principle for caregiving robots is to empower care recipients, allowing them to take control of their own lives and make decisions about their care. This can be achieved by designing robots that are user-friendly, customizable, and able to adapt to the unique needs of each care recipient. There I go again. I want to encourage a person-centered care profile to be developed for each little robot that takes care of us. By empowering care recipients, robot caregivers can help promote independence and self-sufficiency, ultimately leading to better health outcomes and an improved quality of life. Balancing assistance and independence. Another crucial design principle for caregiving robots is to strike a balance between providing assistance and promoting independence. While robots can help care recipients with daily tasks and provide support, they should not create a sense of dependency or undermine the care recipient's sense of self worth. Hey, I'm an old rehab nurse. One of the hardest things that a family caregiver must learn is to allow your loved one to do as much as possible for themselves as they can for as long as possible. This is so painful and hard for so many caregivers to watch a family member struggle with dressing, eating, or other activities. Human caregivers must learn patience. I understand that it's faster and easier to just do it and get it over with, but it creates dependency and impacts the care recipient's self esteem and well being. So I would love to see a robot caregiver encourage and support only when needed. By balancing assistance and independence, robot caregivers can ensure they are providing the necessary support while still fostering a sense of autonomy and dignity in care recipients. And this is a lesson our human caregivers would benefit from learning as well. Addressing emotional dependency and ethical concerns. Finally, it's important to address emotional dependency and ethical concerns while designing caregiving robots. This includes ensuring that the robots do not foster unhealthy emotional dependencies or violate the privacy and autonomy of care recipients. By adhering to ethical guidelines and design principles, caregiving robots can be developed in a manner that respects the rights and needs of care recipients while also providing the necessary support and assistance to improve their quality of life. In addition to design principles and ethical guidelines discussed earlier, it is essential to address social and cultural factors in robotic caregiving. This includes ensuring accessible and inclusive design, overcoming socioeconomic barriers to adoption of robotic caregiving, and promote cultural sensitivity. So let's explore how these factors can be addressed to ensure that robot caregiving is both effective and inclusive for all members of society. Accessible and inclusive design is a crucial aspect of robotic caregiving. By creating robots that are easy to use and understand for both caregivers and care recipients, we can ensure that everyone, regardless of disability, age, or cultural background, can benefit from robot assisted caregiving. Here in the USA and in this country, we also have so many people have come to live from all over the world. Many seniors that relocated here never learned English. And I can tell you how many times I have had to provide care for someone that did not understand what I was saying. And dementia patients that speak several different languages, as their dementia disease progresses, often revert back to their mother language. And I love the fact that a robot would be able to be there to translate for both the human caregiver and the humanoid robot. And again, a person centered profile in there would tell me what they like to eat, what their family's about, what they did for a living. I just see that as a very positive thing. Accessible and inclusive design also allows for customization and personalization, ensuring that robots can be tailored to meet the unique needs of each care recipient. Yep, let's go to person centered care profile robots. So now we have to address socioeconomic barriers to adoption of caregiving robots. Addressing the socioeconomic barriers to the adoption of caregiving robots is essential to ensure equal access to care and prevent the exacerbation of existing healthcare disparities. This can involve offering subsidies and tax breaks to those who cannot afford robot caregivers, providing education and training for those who are unfamiliar with the technology, and forming private and public partnerships to ensure widespread access to robot caregiving services. By overcoming these barriers, we create a more equitable, inclusive caregiving ecosystem that benefits everyone, regardless of their socioeconomic status. Finally, it is important to promote cultural sensitivity in robot caregiving. This involves designing robots that are aware of and respectful of different cultures, providing training and education to those who are unfamiliar with the technology, and ensuring that robots can recognize and adapt to various cultural norms and values. In summary, as we explored throughout this audiocast, the rise of caregiving robots holds great potential for revolutionizing the way we approach caregiving. By addressing the various challenges and considerations associated with robot caregiving and implementing effective strategies, design principles, and ethical guidelines, we can harness the power of technology to improve the lives of care recipients and alleviate the burden on human caregivers. As we continue to innovate and develop new solutions to the field of caregiving, it is essential that we strive to create a more compassionate, inclusive, and effective caregiving ecosystem that benefits everyone involved. As a bonus, before we go, I want to ask a few frequently asked questions that you may want answered. How much does the robot caregiver cost? With an estimated cost between US dollars of 168,000 and 225,000, a caregiver robot is an investment compared to the cost of a full-time human caregiver for 3 years. So it's a 3-year salary for one human caregiver. So what is a caregiver robot? Caregiver robots are designed to assist humans in providing care to the elderly, disabled, and others. They can be used in both nursing homes and other residential settings, helping to relieve the burden on humans who may not have the capacity to manage all the tasks associated with daily care. Caregiver robots are sophisticated machines that are designed to provide assistance to human caregivers in the form of physical and emotional support. These robots can help with various tasks around the house, from cleaning and cooking to playing games and providing companionship. There's even one that does laundry. It washes it, dries it, and folds it, up to 50 pieces of laundry. That's amazing to me. They are invaluable assets to those caring for others. Is there a robot that helps the elderly? Yes, there's a robots that help the elderly. Care robots come in various shapes and sizes and can offer physical care assistance, such as helping people get up, monitoring their physical activity, and providing assistance with eating and bathing. These robots can also provide emotional support, such as providing companionship and conversation, and can even help with cognitive tasks, such as reminding people to do something. I hope you'll follow this blog as I address the ever-changing and growing caregiving market. Can AI replace caregivers? No, artificial intelligence cannot replace caregivers. Artificial intelligence can be used to assist and supplement care, but ultimately it requires the knowledge and expertise of human caregivers for successful patient outcomes. Artificial intelligence can help reduce the burden on healthcare professionals by automating mundane, freeing up valuable time for more pressing matters. Overall, artificial intelligence has the potential to provide much needed support to caregivers, but should not be viewed as a replacement for them. Human skills and experience are essential when it comes to providing quality and compassionate care. AI, artificial intelligence, can play an important supporting role, helping to lighten the load and allow caregivers to focus on the needs they want to excel. This lesson has been brought to you by Caregiver Relief. I'm Diane Carbo, RN.
Thank you for watching. Don't forget to hit that subscribe button and ring the notification bell so you never miss an episode of Caregiver Relief. If you have any thoughts, ideas, or suggestions for future videos, topics you'd like us to cover, or even improvements you'd like to see on the channel, drop them in the comments below.